confirming the order, looking over that I have to discontinue an interdwelling catheter. So I'm going to get a drape, some gloves, and a 10 milliliter syringe. Okay. I'm going to go to the patient's room, knock on the door. Come in. Okay, coming in, opening the door, closing the door. Curtain for privacy. Hi, my name's Sarah. I'm a student nurse at Ranger. I'm a student ranger at nurse. And I was just going to take out the catheter. I bet you're super excited. Okay. May I have your name and date of birth? Yes. Alrighty. Okay, so what we're going to do is, there is some, I'm sorry. We are just going to take a few minutes and get the sucker out of you.
Provide pericare and examine the urinary meatus.
Okay, everything looks good.
Position the patient before you set up the sterile field. For a female patient, ask the patient to flex her knees and place her feet as far apart as possible.
Do you think you could just flex your knees? Here you go. All right. I know it's a little uncomfortable, but just try to widen your legs a little bit more for me. Okay. Thank you.
Remove the catheter kit from the outside plastic packaging.
Dispose of these in the trash can.
Turn the edges of the plastic bag to the outside without contaminating the inside of the bag. Place toward the end of the bed for use as a trash receptacle. The inside of the bag is still sterile, so if your gloves or forceps accidentally touch the inside as you discard items, they will not be contaminated. Position the catheterization tray. For a female patient, on the bed between the patient's legs. Open the distal flap of the tray first. Bend both side flaps and the flap closest to you last. Remove the sterile drape from the catheter kit without contaminating the contents of the tray. Put the sterile gloves provided in the catheter kit to prevent introducing pathogens into the urinary tract during catheter insertion.
Okay. Do you mind if I just put these gloves on? I'll just put them right there. Okay, you're fine. Okay.
Lift out the plastic tray and place it on the sterile field, avoiding the 1-inch unsterile outer margin. In the kit, pick up and open the lubricant and squeeze it onto a section of sterile plastic tray. Open the package of Benadine and empty the contents over the cotton balls.
These are Benadine swabs.
Some kits may be packaged with Benadine swabs instead of cotton balls and liquid Benadine.
Separate the swabs.
Lift out the sterile catheter, which will be encased in a clear plastic bag or sheath to provide extra security for maintaining sterility of the catheter. Leave the plastic cover on the catheter while you Using your dominant hand, pick up the syringe containing sterile water and screw the luer lock tip to the colored port on the second lumen of the catheter. The second lumen is located at the Y junction of the catheter. While carefully holding the plastic-covered catheter in your non-dominant hand, use your dominant hand to depress the plunger of the syringe to instill the sterile water, inflating the balloon. Observe the balloon for leaks. When balloon integrity is ensured, withdraw all the sterile water from the balloon back into the syringe, leaving the syringe attached to the catheter.
Okay.
Carefully remove the plastic cover from the catheter, maintaining strict asepsis of the catheter. Drop the plastic off to the side of your sterile field. Now place the catheter with attached syringe into the sterile kit box within your sterile field. Use caution while you position the catheter. After you let go of it, it tends to flop or spring from the inside of the box to the outside of the box, with the catheter tip sometimes landing outside your sterile field, contaminating the catheter. Cleanse the urinary meatus. Use your non-dominant hand to spread the labia to expose the urinary meatus. While your non-dominant hand continues to separate the labia, maintain exposure of the urinary meatus with your dominant hand. Pick up the Benadine swab or use the sterile forceps to pick up the Benadine soaked cotton balls. Clean in the following order. Use 1 Benadine soaked cotton ball or swab to clean the far labia minora from front to back. Drop the now contaminated cotton ball or swab in the plastic bag you set up beyond your sterile field. Use forceps to pick up a second cotton ball or swab. Cleanse the near labia minora from front to back. Drop the now contaminated cotton ball or swab into the plastic bag. With the last cotton ball or swab, clean straight down from the clitoris over the urinary meatus and down past the vagina. Dispose of the cotton ball or swab as you have previously done. Pick up the sterile catheter with your dominant hand, dipping the tip in the lubricant you squirted on the plastic tray. Lubricate 1 to 2 inches of the catheter tip. Holding it about 1 inch from the tip of the catheter, insert it into the urinary meatus. Advance the catheter until you see urine flowing into the catheter tubing. At that time, advance the catheter another 1 to 2 inches to ensure that the catheter is fully in the bladder. Release the labia and with your non-dominant hand, pick up the syringe and inflate the balloon by depressing the plunger on the syringe completely. Take the syringe off of the connection port and dispose of it in the plastic bag. Secure the indwelling catheter to the patient's thigh with a leg strap or tape. To ensure adequate catheter length for patient movement, secure the catheter at the Y junction.
Oh, goodness me.
Cleanse all Benadine or other cleanser from the urinary meatus and surrounding area. If left on the skin, it may cause irritation. Depending on the structure of the bed, hang the catheter drainage bag from a part of the bed that moves with the patient when raised or lowered, or hang on a stationary piece of the frame that remains static directly below the patient's hips. Avoid using the bed rails. Hanging the drainage bag on the side of the bed nearest the door allows you to do a quick visual assessment of the amount and color of the urine in the bag.
Okay, and then after that, the procedure is finished. We would ask our patient if she was okay while cleaning up our field. Gather everything. And we throw it away. Make sure to position her back to a comfortable position. And cover her up. Lowest possible position. Okay, and her call light is in reach. All personal items are in reach. Can I get you anything? No. Okay.
Evaluate the color, clarity, and amount of urine in the drainage bag after the procedure is completed. Avoid allowing more than 1,000 mL to drain at a time. Clamp the tubing in between drainings.